we were explaining that if we have a look to this lateral border of the scapula, all this muscle was infraspinatus, although just close to the lateral border we can find here like some very thin fibers which may correspond to the teres minor. Okay, so when we move a bit more lateral, we have this lateral border. So from this lateral border as a reference, everything we have lateral to it is going to be or teres major or latissimus dorsi. So which is the main difference? The teres major is being very transversal direction, okay? Because it's coming from the inferior angle. But the latissimus dorsi is going to be felt very oblique. Apart from that, the feeling of the teres major is like a very thick and soft muscle, whilst the latissimus dorsi is very thin and very fibrous, like very cylindric, like it's rolled in itself, okay? So what we are going to do is to try to make a big pincer grip, trying to connect or contact with the lateral border as a reference. So the first muscle we are going to find in this area, in this direction, should be teres major, okay? Sometimes, which is the problem, that for some patients it's almost impossible to make this grip. So another option could be to palpate here, and if we find the fibers of teres major, we can do it flat. But we have to consider especially which is the direction of the needle, so never go in there, okay? So we are going to try with him. So in this case, if I'm right-handed, more or less, I try to be a bit like this, so I'm going to palpate here, or here as you prefer, and then I'm going to do the needling here, okay? Which is the needle length I'm going to use? What do you think? 40 possible, yeah? So, for example, if I'm doing from posterior to anterior, as I'm reaching the teres major just now, sometimes 4 is enough, but if I would be doing from anterior to posterior, sometimes it takes a longer, I have to take a longer needle, okay? But if the patient may tolerate this position, this is a good position, okay? So if we don't know the anatomy, we can also change to lateral, supine, okay? So the only risk for this is that if instead of taking a proper direction, we are moving to the thorax with a long needle, we potentially may be coming to the thorax. Although you have to do it really bad and with a very long needle, so I don't hope so. De agujas, no, tráeme de 4 pues, que creo que... Have you seen the needles here or not? No? Ah, mira, aquí están. Las encontramos. Tell me if it's very painful, just say stop, okay? Because if you move the hand, sometimes I'm not realizing. Okay. Okay, I'm going to tell you again what I feel, so we can check if it's similar, okay? So I'm going to make a big grip here, so eye contact with the scapula.
Lateral,
so,
right?
Yeah, this is the lateral border, so this falling, this is the lateral border. So in my mind, this should be more or less like this. So I change the direction a bit, and I'm trying to feel. I'm going to check this, for example. This is very soft and thick. So I'm going to check if I find, for example, here, this is clearly a trigger point here. So I have this trigger point here, so I'm going to leave a bit of a space, and I'm putting the directions toward my fingers. So in this case, there is no possibility to get the thorax. This is not a long needle. We are not going in the thorax direction, okay? So the only thing that you have to take into account is that if you do it flat, you never move the needle like that to the thorax, okay? So we are going to do a first insertion. This is stiff now. Okay, everything is fine. I'm going to try to palpate a bit better. So I'm going to take this out and try to fix it very well. So this is here. So my feeling is that this is a bit up than the needle. So I'm going to check doing this. Do you feel that? Do you feel twitches or not?
Yeah, minimum. Very
okay,
minimum.
but they are not really big. So perhaps I say, okay, I'm going to have a look now.
Yeah.
Yeah, now big, okay? So I can take it out a little and say, okay, I'm going to recheck. So for me, this is the trigger point.
Enough.
Okay. So regarding the latissimus dorsi, with this same grip, if we just move a bit more oblique our hands, we are going to feel like a cylindric rope, very fibrous, okay? Todo esto. Have you seen, all of you, well, this area? No? So chain a little? Yeah.